can testosterone therapy damage your kidneys? It's a question that comes up more and more as TRT becomes increasingly prescribed, and it's absolutely worth understanding properly. Here's the short answer. Current evidence suggests testosterone therapy does not directly damage healthy kidneys in most patients. But there are some important indirect effects worth knowing about, especially if you have certain underlying health conditions. So let's break it down. TRT, testosterone replacement therapy, is prescribed to men with clinically confirmed hypogonadism, a condition where the body doesn't produce enough testosterone on its own. It helps address symptoms like fatigue, reduced libido, and loss of muscle mass. And in the UK, it's a prescription-only medicine, which means it should only ever be used under medical supervision for a confirmed diagnosis. Now, why aren't the kidneys directly at risk for most men? Testosterone is primarily metabolized in the liver, not the kidneys. At therapeutic doses, it doesn't appear to be directly toxic to kidney tissue in people with normal renal function. So for most men on a properly monitored prescription, the kidneys themselves aren't being directly harmed. That said, testosterone therapy can affect fluid balance and hematocrit. That's the concentration of red blood cells in your blood. Both of these effects can put additional strain on the cardiovascular system, and if that strain goes unmanaged, it can indirectly affect kidney health. Fluid retention, for example, can raise blood pressure, and high blood pressure is one of the leading causes of progressive kidney damage over time. So the concern isn't usually a direct hit to the kidneys, it's more about a chain of effects that in the wrong circumstances can become a problem. This is especially relevant for certain groups. If you have pre-existing chronic kidney disease, uncontrolled high blood pressure, cardiovascular disease, or diabetes, you'll need more careful assessment before starting TRT and closer monitoring throughout. The same applies if you're taking any medications that can affect kidney function. So what does monitoring actually look like? Your doctor should be checking things like serum creatinine, eGFR, a measure of how well your kidneys are filtering, hematocrit levels, blood pressure, and urinalysis. How often these checks happen will depend on your individual risk profile, so it's worth having that conversation with your prescribing clinician if you haven't already. There are also some specific symptoms that should prompt you to contact your doctor promptly. Significant swelling, particularly in the legs or ankles, a noticeable reduction in how much urine you're passing, or unexplained weight gain. These could be signs that fluid retention or blood pressure changes need addressing. And importantly, if you ever experience severe shortness of breath, chest pain, sudden marked swelling with breathlessness, or confusion, don't wait. Call 999 or go to A&E immediately. Treatment may need to be reviewed or paused if kidney function shows signs of deteriorating, hematocrit rises to a level your doctor considers unsafe, or fluid retention becomes apparent. These aren't reasons to panic. They're exactly why monitoring exists. And please never start, stop, or adjust your testosterone without guidance from your prescribing clinician. So to recap, testosterone therapy doesn't directly damage healthy kidneys in most patients when used appropriately. But it can affect fluid balance and hematocrit in ways that may indirectly impact kidney health, particularly in men with pre-existing conditions. Regular monitoring is essential, and the frequency should reflect your individual risk. As always, speak to your GP, prescribing clinician, or pharmacist for advice tailored to your specific situation. Nothing in this video is a substitute for personalized medical guidance. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health content.